Hello, it's Elizabeth. I'm back. I had my surgery for my dehiscent semicircular canal 1 month ago. And as promised, I am here to tell you what I experienced, because if you're anything like me, you want to know exactly what you're facing. So, of course, everyone reacts differently to surgery and to pain and etc., but these are my experiences. So my surgery, day one surgery, it lasted 2.5 hours. Dr. Wyatt had predicted 4 hours, so it was an hour and a half less than he had predicted, which is great. And he was assisted by Dr. Kazin, a neurologist, because they are dealing with your brain, lifting it out of the way, etc. So the first day you are in ICU, neuro ICU, and they check on you every hour, make sure everything's draining properly and there's no infections and etc. And I gotta say, I was shocked at how much pain I was in. I had heard from another woman who'd had this surgery that she didn't experience much pain. That was not the case with me. It was incredibly painful. Apparently it hurts to get your skull cracked open. So I was pretty well drugged up for the first couple of days. So after I was in my ICU room for about an hour, Dr. Wyatt came in and checked on me, and he scratched on my bandage to make sure that I could hear, and I could, which is a really good thing, because he had been extremely concerned that I was going to be completely deaf in that ear after the surgery, because I had the largest dehiscence he had ever seen. It pretty much ran the whole length of my canal. And also I had what he called a Tegman's dehiscence, which the shelf that the brain sits on was completely covered in holes and looked like a sieve. So he had to fill all that too. So yeah, the first night you're in neuro ICU, and then next morning you move to your regular room. I'm going to skip the part about removing the catheter. They want you to get moving, so the first day two, you're walking around. I just kind of walked up to one end of the hall and back, and that's pretty much all I could handle. Now, everyone said I would have a lot of dizziness and nausea. I didn't have any of that. I just had the pain. Yay. That afternoon, they removed the bandages. I was quite pleased to see the strip of hair that they removed was actually a lot smaller than it felt when he was shaving my head. And it kind of goes back at an angle so that my hair covers it and you don't really see it too much. And also, a lot of people had a cut in front of their ear, but mine ends right here at the ear, so nothing visible. Yay. I had hoped when he removed the bandages that I would hear everything, but I didn't. Now, one thing I noticed that kind of concerned me was that all of a sudden I did have symptoms that I didn't have before, like the nystagmus, where with every heartbeat, everything was moving like this in the room, and watching TV was impossible. Luckily, that went away after a couple of days. But my hearing did take a lot longer to come back. It was just slowly, I guess with swelling going down and healing, it came back slowly. Day 3, I was just plain uncomfortable. I wasn't sleeping as much the first 2 days. Pretty much slept about 23 hours a day. But day 3, it was more normal, but I was just really uncomfortable. No appetite whatsoever. The whole time I was in the hospital, I probably ate 1 saltine. But whatever. Dr. Wyatt said I could leave the night of day 3, but I was still so miserable that I stayed and left first thing in the morning on day 4. So about day 7, I started going out for walks. My mom was taking care of me for the first 2 weeks and forced me to eat every day. And she went for walks with me. First day, I went about 2 blocks to a park near me and back, and it kind of feels like you're walking in a fun house. You're just a little unsteady, and it just feels like the ground is kind of moving beneath you. But the more you walk every day, the better that feels. After day, every day I would walk a little more, and after a couple days we were walking 4 to 6 miles a day. And I found that as I was walking, if I looked from side to side, that's when I would start to veer off and lose my balance. So I figured that's probably the best thing to do to regain my equilibrium. So day 10, I get my stitches out, and he drained some blood from inside my ear. Still, my hearing is still muffled, but it's a little better every day. And then 2 months from getting the stitches out, I see Dr. Wyatt again, and he'll do another hearing test, and hopefully it'll be all back by then. So day 17 was the first day that I didn't have that autophony, the noises inside my head. Every morning I would kind of hum to myself to see if I could hear it in my head, and day 17, it was gone. So, and now here we are 1 month to the day afterwards, and everything sounds great. I could tell there's still a little bit of hearing loss, still a little bit muffled, but every day it gets better. So I'm pretty confident that I'll have it all back by the time I see him in another month. So this is what my scar looks like now, 1 month later. It's still raised, it's still sore, but I expect it's gonna probably hurt for quite a while. So those are my experiences with the surgery. Good luck with yours. If I didn't answer all your questions, leave a comment and I will respond as soon as I can. Thank you.